There are a lot of things that I've covered about COVID-19 on this channel that just goes against what you're being told in the news media. Stuff especially from Reason Magazine, but also from Tech Dirt and other places. And it's amazing if you go and do your research. I know the conspiracy cranks have sort of co-opted that, and they've got all this stuff about how, COVID-19 isn't real. No, it's real. It's real. But, I mean, here's some good information on it with kind of an update of one of the effects I've been talking about is, because the question I've had for the lockdown people is, what's your end game? How do you end the lockdowns? At what point do you say, okay, we can go back to our lives now and get everything back to normal? So we really need to kind of get some things spread around the healthy population to get herd immunity, which is what I've been talking about. And so that's what this article is saying, that the COVID-19 epidemic could fade away this fall without any new lockdowns. So we might be able to avoid another higher wave of it altogether. So he goes off. I'm sorry, who is this? This is Ronald Bailey. He starts off talking about just the failures the government has done. People who say that COVID-19 proves that we need government, they don't know what they're talking about. I've covered this over and over again. Government has failed and failed and failed and failed and failed, including groups like the CDC and the WHO, who were created for precisely this kind of scenario. And also the obstructionism of the FDA and why that's a bad idea and everything. So, right. So he says, what has been learned over the past 8 months? While conclusions are still preliminary, researchers now calculate that the COVID-19 coronavirus is about 3 times more contagious than seasonal flu. The availability of diagnostic testing in the U.S. is greatly improved, but still nowhere near where it needs to be. Why won't they allow the home tests? Someone explain that to me. I mean, I get that they're not quite as accurate as a full nasal test, but they're close, and you can do them in like 5 minutes and get results. And I said this before. You could do that where, if you want people to come back to work, okay, you want to come back to work here, take this saliva test. And if you pass that, then we can get people back to work that way. And it's just, they just won't do it. It's crazy. Absolutely crazy. Airborne transmission contributes significantly to the spread of the disease. When the background rate of infections is high, the widespread adoption of face masks is an effective and very economically valuable method of stemming COVID-19 infections. When epidemiological models took into account actual changes in human behavior, the COVID-19 death projections declined steeply. And then he goes on about hydroxychloroquine, and look back on this video. It has kind of gone back and forth. There was this one study that was based on completely fraudulent data. And that was the one that caused everyone to hit the panic button and say, oh, no, this is going to kill people. We can't use it. For I forget how long. It was weeks before it was finally revealed that it was based on completely fraudulent data. So that kind of delayed everything, and then testing started getting back up. And I think the newer testing is saying, actually, yeah, it does have some benefit and doesn't have the horrible side effects that the other test had said. So, epidemiological research suggests that COVID-19 will only fade away once the threshold for herd immunity is reached. Without a vaccine, that just means people spreading the virus around. That's just it. So, he talks about how we've talked about how herd immunity works plenty of times, but and we've also mentioned that the threshold in COVID-19 is 60 to 70%. So, preliminary studies on suspected pre-existing T-cell immunity to the coronavirus and speculative modeling results suggest that the effective herd immunity threshold may actually be close, at least in some countries and some regions of the U.S. In other words, the possibility of a lower herd immunity threshold is a lucky accident, not the result of presidential prescience. He goes all about criticizing Trump, which is fine with me, but I'm not going to take time in this video doing that. I just want to talk about the science. So, he talks about a new modeling study published in the Proceedings of the National Academy of Sciences, PNAS. So much fun to say, PNAS. Yes, it's the new PNAS study from the University of Illinois at Urbana-Champaign, which says that the COVID-19 heterogeneity modified herd immunity threshold has already been reached in some metropolitan areas of the U.S. And the difference with this model is that the other herd immunity models basically assume that everyone was equal, everyone was equally liable to become affected, everyone was equally liable to transmit their infection to others, and that's how the basic model works. This one was a little more sophisticated. They define heterogeneity as the biological and social susceptibility of individual members of the population to COVID-19 biological infection, taking into account differences such as the factors of the strength of immune responses, genetics, age, and comorbidities. And it reflects variation in the number of close contacts that each individual has. Basically, the more social a person is, the more likely they are to get infected early in the epidemic and then become immune. The researchers combine biological and social heterogeneity to derive what they call an immunity factor. And then they test it using empirical data from hospitalizations, ICU occupancy, and daily deaths from New York City and Chicago. They talk about the effective reproduction number, and we've talked about that before. The R null, R0, whatever you want to call it, is the number of people that an infected individual would go on to infect in the natural course of the disease without any intervention. And then the R sub T, I believe it is the current one when we're doing mask wearing and we're doing, the social distancing and we're staying at home more and working from home and doing school from home and things like that. What's it going to be after we've done all that? And so that's the effective reproduction number. And that one changes as you become immunized either through infection or vaccination. Of course, there isn't a vaccine right now, so that's a big problem. So, but it's also affected, like I said, as social distancing and widespread mask wearing, things like that. Mask wearing does work, by the way, and there's links in here if you want to look at that, so stop denying that. Why would it not work? I mean, you're covering your face, you're stopping air from I don't know. Taking the effects of biological and social heterogeneity on COVID-19 transmissibility, the researchers calculate that the herd immunity threshold is likely somewhere between 20 and 30% of the population, much, much lower than the normal R null for coronavirus. And according to recent reports, more than 20% of New York City residents have probably been infected with the coronavirus. Seeking to see what might happen this fall, the researchers model possible outcomes of the second wave of the COVID-19 epidemic in New York City and Chicago. They consider what they call a worst-case scenario in which all current mitigation efforts are fully relaxed and bars, theaters, and restaurants open with negligible social distancing and mask wearing. And that's the worst-case model, and here it is. That's the worst case. Yeah, we're just going down to kind of a background level. There's going to be that little background level at least until you get the vaccine. And it may even be, I speculated on this at the very start. It might be the case that, people 10 years from now when they have kids and they're getting their kids vaccinated, while they're vaccinating them from, pertussis and everything else, they might have to get a COVID vaccine. Who knows? This may be something that's with us forever, but, it doesn't have to be any more of a problem than pertussis. So long term, I'm not that worried, but on the other hand, they calculate that Chicago has not passed the herd immunity threshold. Nevertheless, the effects of biological and social heterogeneity would still result in a substantial reduction of the magnitude of the second wave there, even under the worst case scenario. The possible good news is that their results suggest that the second wave can be completely eliminated in such medium-hit locations as Chicago if appropriate and economically mild mitigation measures are adopted, including mask wearing, contact tracing, and targeted limitation of potential super-spreading events through limitations on indoor bars, dinings, and other venues. Except for the contact tracing, I think we've pretty much figured out that doesn't work. But, basically, you don't have to lock everything down. You just wear the masks, do the social distancing, do the things like they're doing where in the restaurants that have opened up, they have like half as many tables and people are sitting further apart from each other, things like that. that might be all we really need to get through this. But of course, government has to hype this up as like the worst threat since the Black Plague so they can ride in on a white horse and save us. Yeah. They say, based on data from late May, researchers also calculate that most states were then still far away from reaching their heterogeneity modified herd immunity thresholds. However, this summer's surge in COVID-19 cases may have brought some states closer to herd immunity. While the coronavirus may not just fade away, these calculations imply that the U.S. has a good chance to avoid a potentially disastrous second wave this fall if the public maintains reasonable social distancing and mask-wearing efforts. But within those limitations, get the healthy population interacting with each other. Get it spread, because that's the only way you get herd immunity. You know, it's the at-risk population you want to worry about. You know, you want to worry about the elderly. You want to worry about the immunocompromised. You want to worry about, you know, people with, you know, respiratory illnesses, other high-risk people. But locking down everyone is just dumb. It's just freaking dumb, and it always has been. So, thank you so very much for watching. Please share this video far and wide, because that's really the best way to support this channel, or most of your favorite channels today, because I think they're all pretty much getting the same treatment that I am, unless you're this massively popular channel that's in this special partnership with YouTube. You know, I mean, even when you see things like CNN, you know, the videos the CNN posts on YouTube don't get that many views, but they get like all the special privileges to show all of the different footage, you know, like the one I made in the last video about Rand Paul that I didn't want to show because I didn't want to take the risk. Well, you know, CNN gets to show all that stuff, you know, different rules for them than for us. So just sharing this around helps more than you know. And of course, go to donate.bogosity.tv. You can give a few dollars in PayPal or a few cents in crypto, or become a regular subscriber at Patreon and Subscribestar. Get videos like this early and ad-free. Thank you so much for watching. Until next time, stay strong and be free.